Hi, John. I reviewed your test results for the BDI, BHS, BAI, and the BSS. Based on the results of the BDI, which is called the Beck's Depression Inventory, you scored a 32, which puts you in the category of severe depression. It is slightly higher than the cutoff of 30, which would be considered moderate. This shows that depression is an issue for you and something we can further address to help you deal with in the future. The result of the BHS, which is called the Beck's Hopelessness Scale, you scored a 13, slightly lower than the cutoff of 15, which would be considered severe. Being in the moderate category is a positive. However, there is still something to monitor, as long-term studies have shown that moderate to severe BHS scores can lead to an increased risk for suicide if not resolved. We can work on lowering your score through further therapy and provide you an opportunity to just vent and talk about what you may be feeling or thinking. Your score for the BAI, which stands for Beck's Anxiety Inventory, you scored an 18, which falls in the moderate category. 30 is the cutoff for a severe category on this test. 18 is significantly lower than 30. I feel good about this score as it falls in the middle of the category for moderate. Finally, I was not able to review your score for the BSS, which stands for Beck's Scale for Suicide Ideation. This test focuses on suicide and feelings towards others. You did not complete this test, so I wasn't able to provide an accurate assessment. However, some questions that you did answer on this test about suicide contradict previous questions answered on previous tests. For example, you stated you would not kill yourself on the BSS. On a previous question asked earlier, you stated you would kill yourself if the opportunity presented itself. So I would like for you to complete the BSS so we can get an accurate assessment. I need for you to be honest so that we can truly resolve any issues you are dealing with